Good morning, class. My name is Armando Darias, and I'm going to be presenting to you my case study on COVID-19. So basically, we're starting with the patient information and history. Her information goes as following. She's a 59-year-old female with a height of 5 feet 4 inches and a weight of 117 pounds. Basically, her story was that she was not exposed to anybody sick in her family, according to her, but she returned from the States from a flight from China about 5 days before the symptoms began. And all these symptoms that I'm about to show you are occurring in the middle of a worldwide pandemic. Her following symptoms were fever, chills, dry cough for about 3 days, and nasal congestion, which are basically the main symptoms of COVID-19. So basically, the action plan that we're going to take with this patient with those types of symptoms go as the following. Basically, these symptoms present, like I said earlier, COVID-19, so proper precautions must be taken. So the first thing we're going to do are going to be a COVID swab test, which is going to come back as positive. A single view x-ray is done. The reason that we're going to do a single view instead of a two view is to reduce the chance of spread, so the tech will actually go to the patient's room rather than the patient go to the x-ray department. And then the other, if you do want a more detailed view, you're going to have a CT ordered for them. And then the last thing we're going to do to avoid any possible spread is that we're going to give a patient a mask, and they are not to remove the mask for anything while they stay at the hospital. So this is basically going to be the process of imaging when the tech goes into the room. So I'm just going to read it one by one. With a single view chest x-ray being ordered, myself as a tech would take all the proper precautions and proper use of PPE, which includes your mask, eye protection, body gown, gloves, hairnet, shoe covers before entering the patient's room. Once inside the patient's room, you will introduce yourself to them, and you're going to explain the procedure and why they ordered it. The patient might be a little fearful when you walk in, considering that you are all protected, but these are all proper precautions for COVID-19, so they have to be willing to understand that it is a highly contagious disease and you're taking all the precautions necessary for your own safety. Once you've let the patient know about what's going to happen with the following image, you're going to ensure that you are in the correct patient's room. The way you will do that is by verifying the patient's date of birth and first and last name. Once verified, you will sit the patient upright on the stretcher, and you're going to place the 14 by 17 IR behind the patient's back, leaving about 2 inches of the IR above the patient's shoulders. The CR will be at level of T7 or level of axilla, and you will instruct the patient to take one deep breath in and let it out. Then on the second deep breath, you are going to instruct the patient to hold it, and the exposure is taken. Post-imaging. Once the x-ray is done and you've left the patient's room, since COVID-19 is a highly contagious disease or illness, appropriate precautions must be implemented for both patient and technician. Additionally, all areas must be thoroughly sanitized using appropriate cleaning substances. So we're going to go back to what is COVID-19. Basically, COVID-19 is an illness caused by a virus that can spread person to person. The virus that causes COVID-19 is a new coronavirus that has spread throughout the world. COVID-19 symptoms can range from mild to no symptoms to severe illness. You can become infected by coming into close contact with a person who has COVID-19. COVID-19 is primarily spread person to person. You can become infected from the respiratory droplets when an affected person coughs, sneezes, or talks, which is why we use the proper PPE precautions to avoid any type of infection. You may also be able to get it by touching a surface or object that has a virus on it, and then by touching your mouth, nose, or eyes, which is why we wear gloves. Imaging results. The chest radiograph is a quality image depicting airspace opacities clearly The chest CT images are also good quality by showing the ground glass opacities in the lungs, which is a common finding with COVID-19. The common imaging findings in COVID-19 are multibular involvement, rounded and peripheral airspace opacities. The opacities are generally described as ground glass and mixed attenuation. And then a chest CT is then ordered for a more detailed view of the lungs. And then here's an x-ray of the patient. You can see clearly right there, white. And then conclusion: COVID-19 is a highly contagious viral disease that has caused a pandemic that has killed thousands of people. During a pandemic, presenting symptoms of fever and chills indicate a need to consider highly infectious illness. Imaging findings can be non-specific for a specific